my profession and kind of how I got to where I am. And, it's a little untraditional, and what I do is untraditional. So let's get started. So that's a picture of me when I first joined the Army. And I think I was 16 years old. I started college when I was 16. So as an emancipated adult, and you can see that I have a baby face there, as an emancipated adult, I was able to start the Army and start at a community college where I would begin taking courses to get my bachelor's degree, even though I was in a community college that typically would give um, an associate degree. And funny thing, I was in a community college aligned with a high school for engineering and science where you actually started the college courses while you were in high school. So I was in high school starting college, and then I went to a community college kind of starting the bachelor's instead of just the associates. So I was always kind of leapfrogging up with the education slice. So joined the Army, got my bachelor's degree. Oh, finished my high school diploma in the Army because I was already in a bachelor's program. Um, got my bachelor's degree in the Army, got my master's degree in nursing that enabled me to begin my career as a CRNA. And when I got out of the Army, I went to law school. So this is my first doctorate degree in law school. These are the colors of a Juris Doctorate, the purple. And most people thought I was pretty crazy to go to law school when I already had a master's degree in anesthesia and I was a successful CRNA. CRNA is widely known as probably the most difficult and complicated of the advanced nursing specialties. And I decided to go to law school afterwards because, hey, why not? Um, so I really decided to go to law school because of the intersection in jurisprudence with healthcare. I began to get a little bit of a taste of that when I was in the Army, and I learned about health professionals practicing defensive medicine. Now, I began to read a ton about jurisprudence, kind of on the side as something I was interested in while I was practicing as an anesthesia professional. But after a while, I decided I wanted to have a deeper understanding of jurisprudence in the way of getting a full law degree. So that's why I went to law school, so I could have a fuller understanding. Now, the picture on the right with the apricot color robe, that is for my doctorate in nursing. So that was my second doctorate degree. And that is, it's called a doctorate in nursing practice. And that gave me a deeper understanding of healthcare as a system and being able to translate research, conduct and translate research into an evidence-based practice, which is the level at which CRNAs practice. So once I got all this education and knowledge, aside from a daily anesthesia practice, which I continued to do the whole time I'm doing all of this schooling, I decided to merge my law education with my anesthesia education. And there's many ways that you can merge and leverage these two highly specialized areas. One of the things that I decided to do while I was practicing as an anesthesia provider, I decided to start volunteering in organizations where I could have a greater impact on the anesthesia profession. So, one of the ways I decided to do that was volunteering with the national board that provides the board certification for CRNAs. All of the CRNAs in the United States are board certified anesthesia professionals. And you can't say that about most healthcare professions, that every single practitioner is board certified, but all CRNAs are board certified. So I volunteered to participate with writing the certification exam. Um, Once I did that for a few years, got more education on that, I actually ran for and became elected as the first Black board member on the National Board for Certification of Nurse Anesthetists. So that was kind of a big thing. And now there's been several other Black board members, but I was the first one who was elected by the other CRNAs. So that gave me a view of how to run a multi-million dollar corporation, because that's what a board of directors does, and how to utilize board governance and manage fiscal responsibilities. So that's one aspect of um, merging legal aspects with healthcare practice, because even though that is board certification, national certification boards do everything in accordance with accreditors. So accreditors is part of the legal aspects of our practice. Anyone who goes into healthcare, there's an accrediting board that has something to do with their practice. So that is one of many ways that I combined my legal education with my anesthesia practice. But I also, when I graduated from law school, I started a health law consulting business. And when I started teaching at Rosalind Franklin University, I began to do research that involved the intersection of anesthesia practice with things that involve negligence. So either practice issues, poor outcomes, or how negligence affects anesthesia providers. And as a matter of fact, just in 2025, I had two research articles published that involved the intersection of anesthesia with healthcare. So that's a couple of ways that you can merge those things, but there are several others. Here are some photos of me in a critical access hospital. And so anesthesia has some standards of practice that are the same no matter where you practice in the country. But the standards of care can vary based on your resources and the facts on the ground. So the things that we have available to us in a critical access hospital are going to be very, very different than what's available in a level 1 trauma center or in an ambulatory surgery center. But this is a picture of me in the operating room, and this is very similar to what you'll see in anesthesia practice around the country. Now, this is a picture of me volunteering in Eastern Africa when I was in Eritrea, starting up an anesthesia program at the University of Asmara, which is the capital city in Eritrea. So Eritrea is an Eastern African country that's just north of Ethiopia. And they actually began their anesthesia um, school at the university when some of the professionals in the country wanted a higher level of care for their countrymen. People were dying because they didn't have anesthesia, similar to how things were in this country and most of the world more than a few hundred years ago. But there were dozens of people in Eritrea who had been educated in Europe and in the US, and they knew that it was possible for people to have a higher level of care. So I was asked to come over there and help them start an anesthesia education program. So this is what I was doing in this picture. I took a break from working in the operating room to take this picture with this general surgeon who was the head of the hospital. Here are a couple of pictures of me in Asmara, Eritrea. And the picture in the upper left corner is me walking from one of this village here are multiple buildings where the doctors, medical students, nurses, where they live and have their business offices. And behind me is one of the larger buildings where they have medical and nursing education. So I was walking over there to give a class. The picture in the upper right is what we would call a rudimentary anesthesia setup, but this is what was used every day in some of the hospitals there in Eritrea. The gentleman at the bottom is a nurse in Eritrea, but he's studying to become a nurse anesthetist. They don't have any board certification over there, but they still train to Western standards. So he's training to become a nurse anesthetist. And when I came in the room, he stopped. You can see he's kind of standing at attention there, but he was kind of giving me a report on what he's doing and kind of sharing things with me. One thing I want you to notice is I wish I could let's see if you can see my cursor here. Can you see my cursor? Okay. What I am circling is called a vaporizer. And this vaporizer has a little color there. It's a red color. And that color indicates that this vaporizer contains halothane. That medication is something we stopped using here maybe 20 years ago. But when you're in resource limited environments, they have to use what is available to them. So when I went over there and I was helping to teach various things, I had to kind of go into my mental Rolodex of they're using this old drug that we stopped using 30 years ago. Okay, so I need to talk to him about the the side effects and the negative things to watch for, because those are the kind of things for why we don't use it in this country anymore. So very interesting things that you'll see in resource limited locations. So this upper corner, the upper left corner, that's actually the border between Eritrea and Ethiopia. And if you know anything about your geopolitics, this border, just like the border between North and South Korea, is an active war zone. And so I was able to go here um, with some of the folks in Eritrea. You know, they took me there. It was almost like a guided tour. Obviously, we stayed out of harm's way, but similar to South Korea, there's plenty of places you can go if you're with your host and not be in danger. But this is just such a beautiful area in the world. Not many of us get to see. So I wanted to show you that because it has to do with things that I've done because of this specialty. This is also one of the historical buildings in Eritrea, and this is me last year talking about legal elements of anesthesia professional practice. This is me talking to the Michigan Association of Nurse Anesthetists. And I frequently go around the country and I talk about the intersection of anesthesia care and legal concepts because there's such a great intersection with these two professions. And I included these pictures because while it sounds like I do a lot, and I do a lot, it's important for you to carve out time for self-care and to make sure that when you do all of these wonderful things in your future profession in healthcare, it's important to take time out to make sure you recharge yourself so that you have the energy to do these things and to help patients and to do research and to talk to folks like you who want to go into these fields. So now I'm going to stop sharing my screen so that I can talk to you guys and actually see who I am talking to. So before I continue to talk, let's see, does anyone have any questions about the legal background, the law degree, the anesthesia background, any research in anesthesia that I do? Because all CRNAs have graduate with doctorate degrees now. So we all do research before we graduate. We work on ways of translating evidence-based healthcare into the actual practice that we do to help our patients. Um, so does anyone have any questions about that? Yes, go right ahead. Go ahead. It sounds like you're breaking up quite a bit.
I believe it's Esha.
Yes.
Can you hear us? Feel free to send a message in the chat and we can circle back. I do see a question in the chat from Sai. Please let me know if I pronounced that right. They have a question that says, regarding your law background, does this lead into a more logical approach to medicine, or does it lead into a more emotional dynamic where you can see both sides and have a sense of humanity to them?
Okay, great question. Well, one thing that, I was talking to someone about this today regarding a contracts issue. It's very important from a legal standpoint to not let emotion interfere in legal matters. Now, from a healthcare standpoint, I think the law background helps me to have a more comprehensive view of how healthcare is delivered, and it helps me to understand where rules come from and how the rules and standards that we practice under, how those things impact the practice that we perform. So I I don't think I would say it leads to a logical approach to healthcare because things like a scientific method or the way we use research is what I would say leads to a logical approach, not my legal background. That's not what leads to a logical approach. Knowing and having knowledge of a research background, I would say, leads to a logical approach. I would say the law helps me to have a more comprehensive understanding of where regulations and standards comes from. So I hope that makes sense. What was the hardest part? So I think is that Danelle. So Danelle, my education for anesthesia is a master's degree in nursing with a concentration in anesthesia. So the doctorate in nursing and the master's in nurse anesthesia is my graduate education. So I have not gone to medical school. Medical school is for someone who wishes to become a physician. So I'm one of the dozens, maybe hundreds, dozens of healthcare providers with a doctorate degree, similar to your pharmacist, podiatrist, optometrist, dietitian, pharmacist. So all of us that have doctorate degrees who are not physicians. So the hardest part, let's see. I was thinking maybe learning how to put an anesthesia machine together. Um, maybe the physics, the chemistry and physics of of anesthesia. Anesthesia is a specialty where you have to understand the chemistry of of pharmacologic medications, but also how those medications act on various receptors in the body and how that impacts the different health systems, the different body systems. So you've got, your liver and your hepatic system. You've got your kidneys and your renal system. But you've also got the neurologic system, the cardiovascular system, as an anesthesia provider who's a specialist in this field, we have to understand how these drugs work at the receptor level on all of these systems in the body. Because when we give an anesthesia medication, it's affecting every system in the body. So we understand things from a receptor level. And so when you first start anesthesia, so we call it anesthesia school, even though it's a graduate education. When you first start anesthesia school, you start learning about those basics about receptors, and you start learning about the basic chemistry and physiology of anesthesia practice. Because if you don't understand those basics and the foundation, then the more complicated applied physiology is really, really tough. So I would say that's probably the difficult part. Let's see. The most difficult part of your educational experience from BSN to MSN. Um, so from BSN to MSN, that would be the same answer as the prior answer, because the first anesthesia degree was I went in school as a BSN and graduated with the MSN. So that would be the same answer about the chemistry and physics and stuff.
I got a quick question.
Yes.
I know that a lot of people and a lot of our volunteers are always looking for ways to get ahead because applications are always extremely challenging. And you traveled a lot, you did a lot of extracurriculars and research. Can you speak to a little bit on kind of how you acquired that or how you got your foot in the door to be able to do those experiences?
Sure. So, what, so back when, before I went to anesthesia school, when I was a nurse in the Army, ICU nurse, I would always seek out opportunities to volunteer and do extra things, things that were interesting to me but were a need for someone else. So I became an ACLS and BLS instructor. So that's kind of the beginning of volunteering to do something that is aligned with your role, but is an expansion of your role. So once I became a CRNA with that master's degree, I began to volunteer to do things like be on expert panels with writing the C exam. C stands for SEE, self-evaluation exam. And that's an exam that all CRNA students in anesthesia school, they all take that usually after their first year to kind of gauge where they are in terms of learning the materials and kind of retaining things to be ready for their board certification, similar to the first year law student exam. So I volunteered to be on the panel that writes those questions. So then after that experience, I volunteered to be in a professional panel that was surveyed to help make the standards for the board certification. So this, I'm starting to do things that gave me a broader understanding of the profession as a whole. So these are opportunities that were aligned with my role, but were over and above what I needed to do. So that allows you to meet people outside of your regular working area. That allows you to get more knowledge about your role, and it gives you the ability to see what else is out there. What might you want to do? What do you need to do to prepare for higher education or higher responsibility roles? So by the time I went to law school or went to my doctoral program, I knew about anesthesia or healthcare from a much more advanced kind of vantage point than people who did not volunteer and take advantage of these types of opportunities. Doing those kinds of things gives you understanding of healthcare that is really difficult to just get in school. You have to actually do these things to get this type of understanding and insight.
That definitely makes sense. I think Esha wanted to try. We couldn't hear you earlier, but if you want to try again, you're more than welcome
Hey,
to.
is my mic working now?
Oh, perfect.
Yes.
Amazing. Yeah, I think I had to restart my computer. Sorry about that. I was wondering how you decided which pre-health position you wanted to go into. Like you decided to do CRNA and law, so how come you went with that path instead of like JDMD or something similar?
All right. So when I was 16, 17, first starting college, I knew I liked things that had to do with the heart. Cardiology was interesting to me. And as I was walking through the university, the community college one day, I saw the Army recruiter, and we started talking. They can be very seductive because they just need bodies in the Army, and you're trying to get your health care, your college paid for. And I told them what I was interested in. And they told me that, well, if you go into nursing, you can get into your beginning undergraduate degree and learn a lot more about healthcare. And so I did a quick research and decided, okay, yeah, I'll join the Army, get my undergrad paid for, and find out what else is in there. So once I got in the Army and got my nursing undergrad paid for, while I was in meeting people, seeing how things worked, I learned very quick that most of the anesthesia providers that give anesthesia in the Army are CRNAs. And nearly all of the anesthesia providers that give anesthesia in war zones are almost all CRNAs. And so I started to learn, hey, this anesthesia is maybe that's something I want to do. So I learned more about it, learned about how the big emphasis in with cardiology and neurology, which were my big passions. Even though I didn't know all the anesthesia details, those were things that I was passionate about, even back 16, 17 years old. And of course, now that I'm in the Army, I'm getting a little older, but I'm finding out more about it and learning that I'm really passionate about that. So that's how I got into anesthesia, because of those passions. And then once I was in the Army as a CRNA, I learned about the defensive medicine, and I decided, I'd like to know more about jurisprudence and administrative law and regulatory law, and why do so many people do so many extra things within healthcare? What's the nexus behind this? So that is why I decided to go to law school when I got out of the Army. So when I got out of the Army in 2004, so I've been out of the Army for 22 years. I was in for 18 years, and I've been out for 22 years now. I feel really old when I say that. But when I got out, I went to law school. So I was already a CRNA going to law school. So that's kind of how that started.
And then regarding joining the army, I was wondering, I've heard about, I think that it's the HPSP program where basically the military pays for your med school and stuff like that. What do you think about that? And how did you deal with the tuition and everything that came with all the education you went through?
Yeah, so there are several ways that the military can pay for medical school, any advanced degrees, things like that. The method that I took was called green to gold. And that green meaning kind of your uniform green, and gold meaning second lieutenant, the color of the gold bar you wear. Um, so I used the green to gold method because it was a method to pay for the healthcare education from someone who was already on active duty. Um, and there's still several ways to do it, and you'd have to talk to a healthcare recruiter. And it's really important that you talk to a healthcare recruiter because regular recruiters don't always know about all the ways to get your healthcare education paid for. So I did Green to Gold, and they actually paid me to go to school. I went to the University of Arizona, and they also gave me a stipend to help me live on while I was getting my bachelor's degree um, in nursing. Now, when it was time for the master's degree, I was paid on active duty. I was on active duty as an officer. So once I became a nurse, I was an officer, second lieutenant, first lieutenant, captain. So when I went to anesthesia school, I was paid as a captain the whole time through. So that's really good money. It's like I don't know, 80, $90,000 a year, something like that. And while you're in graduate school. So that's a pretty good deal for being in graduate school. There are other ways that the Army can pay for your education, and you would want to talk to a healthcare recruiter. Of course, all the different branches are all very different. I can tell you about the Army, but there's also Navy/Marines, and there's the Air Force. Coast Guard uses Navy officers. So lots of different ways. HPSP is just one way. So you would want to find out about all the different ways that the military is paying, so you can find out which particular program works best for your needs. Here's a question from Rubnik, I think. Experience reviewing standards of care, CRNA. What clinical habits that students develop early to ensure they become safe, effective providers? Okay, great question. So from my experience with understanding standards of care and serving on the NBCRNA, probably what I would say is best clinical habits is knowing, understanding, and adhering to standards of practice. Now, standards of practice and standard of care, like I mentioned, are different. People often say them interchangeably. And unless you have been at the wrong end of a negligence claim, they seem like the same thing. You're going to hear people say they're the same thing, and they will proclaim that to you as sure as the sky is blue. Don't argue. You don't want to start a fight. Let them say that. However, standards of practice are the standards for your profession that are expected in all settings at all time, no matter where you're working, for every patient. So that's things like getting a history and physical, taking vital signs, getting informed consent before a procedure, things like that apply to every patient all the time. Standards of care are things that are different depending on facts and resources. So standard of care, say in a level 1 trauma center, might require certain interventions for a stroke patient in terms of uh, um, using antiplatelet medications and getting a CT and doing imaging within an hour. That wouldn't be the standard of care in a critical access hospital because you don't have the capabilities for stroke care. So the standards of care vary depending on fact situations and resources. So one of the things that I think is most important for clinical practice, no matter which health profession you have, whether you're a podiatrist, a pharmacist, a physician, a CRNA, an ophthalmologist, know what the standards of practice are for your profession and make sure you adhere to them. Those standards of practice will often get updated every few years. So it's important to remember that what you knew as the standards of practice that you were taught when you were in graduate school, it's not going to be the same standards of practice for the whole 20, 30 years that you're practicing. You've got to stay updated on those so that when they change, you know about them and your practice is commensurate with that. Because if someone ever gets harmed and they decide to sue, the first thing that an expert like me is going to look at is what was the standard of practice at the time of this injury, because you will be held to have known those standards of practice. And if you graduated 15 years ago, but you don't know the standard of practice today, there's no excuse for that. So that's what I would say is the most important thing that that you should know early in your career and through your entire career. All right, Layla says, how did I have time to balance everything? Well, I'm a pretty organized person, have always been pretty internally motivated, meaning things that I deem important. I have a strong desire to get them done, especially when I make a commitment to get something done. So I don't, I'm not the type of person that needs someone else to ask me to do something, or necessarily needs to have a deadline kind of roaring ahead here. Once I get a list or a tasking, I make a priorities list to get things done, and then I kind of make a way to get it done. So when things are interesting to me, it's kind of easy to do them. Like for instance, I like talking about the profession and how I came to do what I do. So when I was asked to talk to you guys, hey, that was easy. I said, yeah, for sure, I'll do it because I like talking about these professions. So, even though I do a lot of things, they don't seem hard to me because they're things that I like to do. That's why I had in the slide there, if you do what you love, the saying goes, if you do what you love, you never work a day in your life. So um, that's 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 kind of how I found time to do everything. Yes, Olivia.
Hi there. Hi, Dr. Chambers. Thank you so
Hi.
much for speaking to us today. I had sort of a two-part question. The first one being, how do you maintain a lifelong passion for healthcare? And what is motivating you on a daily basis in our corrupt American healthcare system?
Yeah. So how do I maintain um, what motivation in healthcare? Yeah. Um, well, I work at an institution that enables me to really function in the aspect of anesthesia care that really stimulates me. And so I work with students who want to be CRNAs, but I work specifically with research and outcomes optimization. So the way I approach outcomes optimization is I approach it from standards, professional practice, the patient's perspective, and what happens when you're not functioning to the top of your ability in anesthesia. So there's many different ways you could teach leadership and clinical outcomes management, and that's the name of my course that I do every summer. But the way I approach it is the patient's perspective and what happens, what can happen when you don't use evidence-based research to inform your care. So I approach it that way for a number of reasons. Number one, I'm a member of a group that has historically suffered mightily because of providers who did not respect us and did not care about our outcomes. And I've seen that happen to members of my family, members of my community, and other people, not only people in my group, but people in other groups. And so my desire to kind of help make sure that doesn't continue to happen is what keeps me motivated in what I do. And I'm very, very blessed that I'm in a program at my university where I can do that in the way that that stimulates me. Not all educators can say that, so I'm very, very fortunate there. Um, I think that answered both questions. Um, okay, all right, thank you. Thanks, Olivia.
Thank you so much. Thank you.
You're welcome.
I see we have a question in the chat that reads, what habits or study areas slash materials really prepared you for the CRNA curriculum? Students are generally afraid of how fast-paced the material is. Is there anything that would help mitigate the shock?
All right, so nowadays, because it is so competitive to get into an anesthesia program, and when I say competitive, we have 50 seats per year in our program, and I think we got close to 900 applications. So yeah, that's pretty crazy. Um, there's like other programs that have, say, 20 seats and they'll get like 400 applications. And that's kind of how it is around our profession. So what we typically tell students nowadays to make yourself stand out, aside from getting something called a CCRN, which is a Certified in Critical Care Nursing, um, take advanced courses that demonstrate your ability to excel in graduate work. So most students will take graduate statistics, graduate chemistry, graduate physiology, um, graduate anatomy and physiology. And the reason I say graduate is because we don't want someone to retake an undergraduate course and get an A in that, which is wonderful, but we want to see you take a graduate level chemistry or physics or biology, but really stats, physiology, anatomy, um, those types of things. Those are things that have direct bearing on the curriculum in the anesthesia program. So that's probably some of the best ways to prepare for the academic part. For the other portions, because an anesthesia education can run 150,000, 200,000, $300,000, definitely save as much money as possible. What most folks do before anesthesia program is they work extra shifts, obviously, maybe work locums instead of regular staff at a hospital. If any of you are already working in hospitals, then you know that locums providers make 50% more, if not double, what hospital staff makes. So all of the people that go into a CRNA program are experienced ICU nurses. So because they're already licensed as experienced registered nurses, many of them take locums jobs so that they can make more money. You don't have to do that, but that is one thing that can be done to help prepare, because you really can't work when you're in the anesthesia program. People who try to work while they're in the anesthesia program, their grades suffer and they may not make it through the program. They probably won't. If they work a little bit in the beginning, they quickly learn that they have to stop working within a few months, because you really cannot work while you're in an anesthesia program. So the academic courses, and then working and saving money, and probably the last thing is get your family or significant other ready for the commitment that you're going to have for the 3 years that you're in the anesthesia program. It is a very, very heavy commitment. In the beginning, your classes might be 2, 3 hours a day, but your studying will be 8, 10, 12 hours a day. So, it might be 8 hours to start, but it'll quickly ramp up to 10, 12 hours a day. So people have to understand that anesthesia and the studying, that's your job. That's your new job. Folks cannot think that whatever you did in your bachelor's degree is going to work for anesthesia school. It is not the same. And many people will find out very quickly that the strategies that they use for undergraduate education have to be modified quite a bit for anesthesia. It is not the same, not the same at all. Yes, is that Layla, maybe? Isla?
Hi. I was just wondering, if you faced any cultural barriers with your patients or language barriers, because I know in healthcare, language barriers can be like a big problem. So if you had any solutions or any, just like stories about it, and if you'd like to share that.
Sure, sure. So I'll take the easy one first. Let's go to language and then we'll talk about culture next. So for language, many hospitals, I don't know if I could say most, but many hospitals have interpreters available for the languages that are most common for the patients that they serve. And one of the reasons why they either have interpreters or they have an official interpreter line is because it's very important that you communicate regarding the H&P, informed consent. You really want someone that has a healthcare background, which the official interpreters would. Families are not always your best use because, for instance, some families and some cultures don't want to talk about some of the things that you've got to talk about in healthcare. And so they may not translate what you're trying to say to the patient properly. So then a patient might give consent for something when they didn't understand fully what's about to be done, or they may give consent for something different than what's actually going to be done. So you've got interpreter lines. For me, the language that I encounter the most is Spanish. So I speak a little Spanish. I speak a lot more than most English speakers, but not enough to be completely fluent. For the parts that I'm not able to say, I either use an interpreter line or I use a translator app. But most of the larger academic hospitals that you may go to for your medical education, nursing education, graduate education, they'll be big enough to have an official translator line. So now cultural differences, I've not had, now I'm a very upbeat and positive person, so I'll say I haven't had a lot of cultural issues. I have run into some. The biggest cultural issue being probably the racism in our country. And I have had some run-ins with that. Probably the biggest one that sticks out, and I can smile about it now because it was so silly and it was so long ago, but it's really sad. It's really, really sad. But I was in Mississippi about to give anesthesia for a case. And when I introduced myself to the patient as a person that would be giving their anesthesia, this woman, older white woman, her eyes got completely large and she went white as a ghost because she was so scared and did not want a Black person giving her anesthesia. So we had to find a white man to talk to this woman so she could have her case. So it just so happens that the hospital had an anesthesiologist there. He wasn't doing any anesthesia. He was actually in a lounge sleeping somewhere, but he was there in the building. There are a lot of places around the country that have an anesthesiologist on staff, to have an anesthesiologist on staff, and this was one such place. So we went and found him to let him know that this patient wanted to see a white man so she could have her procedure done. So we went into the OR, and the anesthesiologist, he stood in front of her so that she could see him as she was going to sleep. And we all kind of laughed at the absurdity of it because he was standing in front of her. So if you guys have ever been in an operating room, you do anesthesia from behind the patient. So I was doing the anesthesia, giving her meds, putting her to sleep, intubating her. I did the whole case. And then when her surgeon came in, he'd scrubbed his hands, he was getting ready to start. And we told him what his patient insisted on. He was livid. Surgeon was a white man. He's a little younger though. And he was absolutely livid. And he turned red and he said, Pam, if you had let me know what happened, I would have canceled her case because I don't stand for it. And he said an expletive, stuff like that. Now I'm mad. So it was quite funny. He bought me lunch. We all laughed about it. But that was probably the biggest thing. Um, you know, I am in a position and in a state in my career. I've been doing anesthesia for 26 years. And when I've run into people who have been racist in the recent time, like in the last 10 years, uh, I have gone to surgeons and said, hey, your patient doesn't want me to do their anesthesia. You let me know how that goes. And then I go and I'll put my feet up and have some coffee. Because now I understand, obviously, you can't do surgery without anesthesia. And if your patient doesn't want me to do your anesthesia, you've got a problem there. I don't argue with the patients. I don't fuss with them. If you don't want me to do your anesthesia, I don't have to do it. I make the same money whether I do your anesthesia or not. So it's a matter of perspective. Those types of things will get a lot of people very, very upset. I kind of feel like life is too short to get upset over someone else's ignorance. So I just keep moving on.
I like that phrase, life's too short.
Yeah, it really is.
I know that a lot of people are kind of iffy back and forth, and Richard, I'll call on you next. On Are iffy on joining the military or kind of signing yourself away for a few years and doing that. Is there anything that you regret or you'd change from that decision, or did you love that decision?
Well, love's a strong word. Um, I'm not sure I really regret it because I got education that you can't get anywhere else. Because I learned how to give anesthesia in war zones, I can do any kind of anesthesia anywhere, anytime. Nothing scares me. Um, Most of the time when you run into anesthesia providers who were educated on the civilian side, I definitely am not going to say all, because you have some really gutsy people out here who are not afraid of anything. But because I've done things like 36 hours of anesthesia, and anesthesia in an aircraft, and jumped out of a moving helicopter, things don't scare me. So that's probably the biggest asset from being in the military. Um, the racism is pretty harsh in the military. And obviously, I wish I hadn't gone through that, but it gave me a really, really thick skin so that the racism that I encountered in healthcare on the outside didn't affect me like it might have if I hadn't been through the harshness of racism in the Army. So I don't even say I regret that because it was a learning experience. Um, I don't really think there's anything that I regret about the military. I'm glad I had the opportunity to meet mentors that taught me how to make it through, how to get graduate degrees, how to make the best of an assignment, how to, um, triumph over some of the adversities in the military. The military, as well as healthcare in general, are places where you've got to get a mentor. It is very difficult to be successful in the military or in healthcare, but definitely healthcare in the military without a mentor. Um, because you sign up for increments, 4 years, 6 years, a little bit longer, because you have those increments, you are able to kind of tap out if it's not for you in terms of signing your life away. So that's a nice thing about the military is you have your incremental obligations, and if you feel like it's not for you, you tap out, you keep going.
Loved your answer to that. Richard, if you want to go ahead and unmute yourself, you can.
First of all, before I get to my question, love the story. I love how certain patients did not wanted you. I said so. Essentially, they practically give you a coffee break.
Yeah, I'll take it.
Yeah, so coffee break while getting paid, and that's awesome. Well, anyway, so I don't drag things on because I know there's others that want to get to it. Um, how was your undergrad journey? Like once you got past your basic GED requirements, like how like how? Because I know you guys want. I know in universities or military want want a degree in certain things in other than the nursing.
Um, well, let me see. Undergrad. I almost don't even remember undergrad. That's a shame how long ago that was. Because undergrad for me was in the early 90s. Um, some of you might not even have been born then. Um,
I I was
um,
a kid then.
yeah, yeah. So undergrad, there was nothing particularly memorable for me in undergrad. So
Hmm.
I might need a little bit more specific question about undergrad because undergrad was relatively easy. You know, the anesthesia school was probably the toughest. Anesthesia school was tougher than law school. Law school was a breeze because I had already gone through anesthesia school. And most people are kind of freaked out that I say that, but you know, law school is tough for sure. It is, but anesthesia school is way tougher.
Shoots. No
Way
one. No wonder nurses that work with anesthesia and anesthesiologists, they get paid so much because that's brutal.
well, yeah, yeah. Anesthesia's tough.
Yes, yeah. Because I was just asking, like, do they require degrees like biology degree or chemistry degree
Well,
or things like that besides the nursing?
so for to apply to a CRNA program, the degree that you have to have is a bachelor's degree in nursing.
Hmm.
So that's something you have to have. So similar to the earlier question of how best to prepare, if you want to be more competitive, then you would take graduate chemistry, statistics, anatomy and physiology, or plain physiology. Those things make you more competitive because there's already several hundred people who already have a bachelor's degree. Everybody has a bachelor's degree. But to prepare yourself so you can be more competitive, if you take those graduate courses and, of course, get an A in them, then that makes you more competitive. There's still more you have to do in terms of you have an interview, You have, various writing things, and there's lots of other things you have to do. But to prepare and be more competitive, you would take those graduate courses that I mentioned.
Yeah, because because no, when I looked at things like biotech or pathologists or assistant pathologists, they usually want like life science degrees, and I was curious if this was no different, but apparently it is straight to the point.
Yes. Yeah. Well, for whatever degree program you're going to, look at what their specific requirements are, because pretty much every advanced healthcare degree is going to have a different requirement.
Hmm,
So you want to look at exactly the requirements for the programs you want to go to so you can get the correct undergraduate degree and you can take the correct extra courses because you don't want to do the wrong thing.
understood. Thank you so much, and
You're
thank you for
welcome.
sharing.
Yes, you're welcome. Okay, let's say I graduated current practice. I'm reading Asha's question here.
Dr. Chambers, since we're recording the session, I'm also just going to read it out loud to everybody, just so
Okay,
the recording has it too.
great.
It says, so let's say I graduated CRNA and I'm practicing. If I wanted to teach currently, is the market super competitive or do they just need anesthesia teaching staff? P.S. It is hard for a woman being black not experience adversity.
Yes, yes, I understand that. So if you graduated as a CRNA and you want to teach, you will have to, well, now all CRNAs are graduating with doctorate degrees. In years past, you could graduate and become a CRNA with a master's degree, and then you would have to go back and get your doctorate degree if you wanted to teach. But now, since everyone is graduating with a doctorate degree, what I would say is look at some of the universities where that have anesthesia programs where you may want to teach and look to see who is currently looking for faculty. There is a great need for anesthesia faculty. So I would say it's probably not super hard to find where faculty are needed. Now, the thing that might be hard is matching your skills with that university and what they need. So, for instance, one university might need sim faculty, or they may need someone to teach anesthesia physiology, or they need something else. So, it's more of a matter of finding the university and seeing what their needs are. But there are needs for lots of anesthesia faculty. The one thing that you want to do is, of course, get a good baseline foundation in anesthesia practice because you're going to get questions about a wide swath of things. And you want to have a good grasp of your practice so that you can help answer some of those questions. So maybe after you've practiced for about 4 years or so, um, start looking for those anesthesia faculty jobs. Also, being a member of AANA as a CRNA, AANA is the American Association of Nurse Anesthesiology. That's the member organization that CRNAs have. The AANA has several conferences each year, and in the spring they have a conference called Edge, and it's the annual conference for anesthesia educators. So go to the AANA website, it's aana.com, and learn about some of the things that are contemporary issues for CRNAs. And I would say if you want to be a CRNA educator, go to some of those EDGE conferences, and so you can interact with, mingle with CRNA educators. And that's a great way to find out who needs help. You get into the room with the decision makers, and that's the best way to kind of get that job if that's something you want. You want to read that one?
I believe you answered that one. Um, I did have a question for you. We have a lot of serious questions. But the more fun question is, do you have like a playlist or a podcast that you listen to when you're in the OR, or specific music types that you kind of recommend or like?
So let's see. If someone asked me to choose the music for the OR, it would probably be jazz. Something like Norman Brown, Richard Elliott, David Sanborn, Rippingtons, kind of thing. I find that music soothing, upbeat enough to keep things moving, but not so uh, loud as to be distracting. Um, Podcasts that I like. Um, let me see. Let me see some of my podcasts because I have a few that I like. On the light side, the Wirecutter podcast, Today Explained, the Journal, the Indicator, Planet Money, um, Post Reports, Explain It to Me. Yeah, does anybody know any of those podcasts, or did I just say a bunch of foreign stuff?
I've definitely heard
Anybody?
of a couple of them.
Okay.
And then kind of stemming off of that question, do you get to always pick the music or the podcast, or is there like a sign-in sheet or
No, no. Well, so um I'll be honest with you. I am the last person to care about music. Okay? So I don't care about the music. Um I'm usually, aside from focusing on the anesthesia and the patient, I pretty much just want the surgeon to operate and get out of the room. That's kind of how I feel. I always have so much going on. I have a lot of things on my mind at all times, and I pretty much want the surgeon to operate so we can all get on with it. So I don't care what the music is, but if they let me choose the music, I choose some type of jazz. When I'm waiting in between things, I don't tend to I don't really tend to listen to music between like 7 and 4. If I have to wait on something, I would probably listen to my podcast, something from New York Times or one of those money things, Planet Money or The Indicator or something. But I don't really, as much as I like jazz music, I don't really care what the music is, as long as you can cut and sew and do it quick.
And then one of my other questions, I don't know if you can answer it. It's been a while since you were in education, but do you know the kind of chain of nursing degrees? And can you go into that a little bit?
So nursing degrees are either associate degree in nursing, which is you would become a RN, a bachelor's degree in nursing, you could be an RN. You could be an RN with associate, a bachelor's, a master's degree, even a doctorate degree, PhD. All of those people can be RNs. Now, if you're talking about advanced practice nursing roles, so in advanced practice nursing roles, if you want to be a CRNA, you're going to get a doctorate degree. If you want to be a clinical nurse specialist or a certified nurse midwife, um, probably going to get a master's degree. Um, what's the other one? If you're going to be an advanced practice, now as an advanced practice nurse, there are several subspecialties as an advanced practice nurse. So you've got adult adult care, adult geriatric care, you've got pediatrics specialty, you've got psych mental health. Um, and all of those subspecialties have their own certification boards, but they're all advanced practice registered nurses. Um, and that's a different role than a CRNA. So an advanced practice adult gero care nurse could not do anesthesia, and a CRNA could not go in into a family practice clinic and do what an adult acute care family practice nurse practitioner can do. all specialty care. But the CRNA is the one that requires a doctorate degree. The other advanced practice nursing roles can have master's degrees. And a registered nurse, you can be a registered nurse at all of those degrees. There's registered nurses with PhDs. Many times they're doing research. They're head of the Department of Nursing. They're head of education. There may be risk managers. Obviously, as you get more advanced degrees, you're probably doing something with wider responsibility. So that's why I mentioned directors of nursing, risk management, CEO of hospitals. You know, those are some things. So hopefully that kind of answered what you did.
Answered it beautifully. I actually somewhat knew about subspecialties. I know that there's an oncology subspecialty, and I'm around a lot of those nursing staff, but didn't know that there was a plethora of them. So that's kind of nice to know. You can move in and move on to different things. So now I went from silly and now I'm going more into the serious. Have you ever, I mean, we're all not perfect. No one's perfect. Have you ever made a mistake? And do you know how you can navigate your mistakes a little better now that you've maybe made a couple or one or whatever it is?
Yeah, everybody makes mistakes for sure. Um, if there's different degrees of mistakes, but when you realize that you did something wrong, you correct it. you know. I've not, knock on wood, I've not killed anybody, but when you realize something has happened that you didn't intend to happen, you fix it. Sometimes it's just something that you fix and you keep moving on. Sometimes you have to tell the patient that you made a mistake. Sometimes you have to tell the other members of your healthcare team that you made a mistake, because depending on what your role is in the different parts of the healthcare team, your mistake may impact what somebody else does. So it's really, really important that if you make a mistake, you share it with the relevant members of the healthcare team. You don't have to tell everybody. You don't have to get on a loud horn about it, but there's other members of the healthcare team that certain things can impact. So, one of the things that you learn in anesthesia is, recognizing when you've made a mistake, fixing it, and then making sure that the patient still has the best outcome possible. So that's how you handle making a mistake. I think we have another question here in the chat.
Oh, maybe it's a private question.
Oh, okay, let me see. Okay, so the question is there anything an undergrad student can do to get clinical experience in anesthesiology outside of a research setting? Absolutely. So when you meet anesthesia providers, or let's say you're in a hospital, you would want to go to the anesthesia department, and all anesthesia departments, they have offices. Sometimes people aren't there all the time, but somebody is there. And you let them know that you are interested in anesthesia and you want to shadow an anesthesia provider. Now, one of the best ways to do that, let's say you want to become a CRNA. So go to that AANA website that I mentioned, and you can see, for instance, when those conferences are. When you go to those conferences and you mill around with CRNAs and students who want to become CRNAs, or RNs who want to just apply, you get to meet people, especially people in your state, probably people in your city, who would welcome to have you shadow them. So when you shadow, you are spending time with a CRNA in their environment with what they do. Anesthesia can be done in a number of places, not just an operating room. You can do anesthesia in the ER, in the MRI suite, in an ASC, in an OB suite, in an ICU, You can do anesthesia in a number of places, not to even mention the military and the many places where you could do anesthesia. Under a tree, in a school bus, in parking lot. So there's when you go and you shadow an anesthesia provider, that's where you get the experience of seeing what we do and seeing if you actually like the profession. Usually when you shadow a provider, you guys have some conversations. They get to know you, what your desires are. Usually once they get to know you and maybe they trust you a little bit, they'll actually let you do some things. Look into the airway once they perform direct laryngoscopy, which is opening the mouth and getting a view of the posterior pharynx. Some of them will let you look in there. They may even let you hold the tube and maybe pass the tube, with them holding your hand. They may let you do something with their equipment. It just depends on the person. But getting to know the anesthesia providers, getting in the rooms where they are, and letting them know what your desires are in terms of going to a program, that's how you get the opportunities to get experience in an anesthesia suite or with a provider. You go in, you tell them what you want to do, and then you shadow them.
Just to expand on that question, the hospitals near me don't accept, like, they don't allow the doctors to have students shadow them. And there are anesthesiologists near me, but they're pain management anesthesiologists, so it's more of a long-term situation. Would you say that even going to a pain management anesthesiologist is useful experience, even if you're more interested in the hospital care setting type of anesthesiology?
Useful. And the reason why I say that is because pain management is a part of anesthesia. Um, Actually, pain management we have a subspecialty as CRNAs in non-surgical pain management. But in anesthesia, as an anesthesia provider, to get a subspecialty, you still have to be an anesthesia provider. So you have to go through being a general anesthesia provider, and then you get the subspecialty. So even if you go and you shadow a pain management specialist, I would hopefully, they will talk to you about some of the general anesthesia things. Even if they don't, take in, learn, absorb what they're doing for pain management. Because even though I don't have pain management as a subspecialty, I know how to do blocks. I'm real good at doing blocks, even though I don't have the subspecialty, because doing blocks is a part of anesthesia. So there is still things that you can learn, even though they're pain management specialists. But now I would also say go to the websites of the anesthesia groups and see what you can find out about state association. Every anesthesia group has a state association, and even they have meetings every year, probably two a year, and you can go to those meetings. The state associations love to have students at their meetings. You don't have to just go to national meetings, which might be hard to travel to. So, like, I'm in Texas. So, let's say, for instance, the Texas Association of Nurse Anesthesiology. They have a spring conference, they have a winter conference, they have a leadership conference, they have conference, and they're all over Texas, Houston, San Antonio, Dallas. So they're everywhere. So maybe going to a state association meeting, again, that helps you to get closer to the people who are doing what you may want to do, and you can potentially get access to someone doing what it is you want to do.
All right, I just have one more question. You had mentioned that you're interested in cardiology and neurology as well. Those are two things that also interested in. I was just wondering how you decided to go the anesthesiology route instead of a more surgical route?
Yeah. So the reason I decided to go for anesthesia is because anesthesia involves cardiology and neurology very, very heavily. It's the core of what we do. Every medication that we give affects the heart and the brain. That's how you actually get anesthesia, is impacting the heart and the brain. Now, we give things that affect other parts too, but you've got to affect the brain so you can produce anesthesia, which is the lack of sensation. And everything we do affects the heart. Um, we have a weird saying, in anesthesias that everything that we give can kill you. It's true, but you learn how to give it so that you don't kill someone. But it's a truism. So that kind of speaks to the fact that all of our drugs have something to do with either the heart or the brain or some associated system. So seeing that I love both cardiology and neurology, going into anesthesia was a way to get into a field that involved the two things that were already really interesting to me. That's why doing something as tough as anesthesia was enjoyable, because I was learning more about those fields that I already had an interest in. When I was a kid, I had a preserved cow's brain on my desk at home, and my mom was worked at a community college, and she was able to get it for me. So I was a very, very weird nerd as a kid. And I don't know if they still have them now, but you used to be able to go to, I think it was Toys R Us, and they had sets where you could dissect animals. And I got this set, and I had a frog that I was able to dissect. And I took out one of the systems. I think it might have been the GI system or something. And I took it to school. And boy, did I make a name for myself. I mean, the teacher took me out into the hallway and told me, "You can't bring those things to school." I was like in fifth or sixth grade. And she just told me I can't bring those things to school. And not everybody is interested in preserved frog guts. And I thought, why aren't they? So fun. So, yeah.
That's so funny. Speaking of that, when I was younger, I used to have these. We had Frost come over and take over the yard, and I had these frogs that had gotten frosted over and passed away, but they were like perfectly mummified, and I thought it was the coolest thing ever. And I brought it to a show and tell, and it's not cool.
Yeah, not cool.
Well, thank you so much, Dr. Chambers. I'm just going to end with our little end outro, and I'll share that with you guys. And if you guys have any last minute questions at the end, you're more than welcome to let us know. Hopefully you don't, and we got to everyone's questions. I loved hearing from more voices this go around. So we always recommend that everyone reflects on every shadowing and every experience you do. A lot of applications require a certain amount of activities. And so this is a great way to kind of showcase that you actually learned and you grew from watching a session. Dr. Chambers had so much little tidbits and advice that I would be shocked if you didn't take anything away from this. So, some three really great questions. I know that I have some personal ones, and you guys can always develop this. That we usually go through is, what was your favorite moment or example from today's session? What's one idea from today that you're more excited to explore? And what's one key takeaway or idea that stood out to you most? And if you write those and you publish them on LinkedIn, if you tag us, we'll actually repost that, and so you guys can have some more affiliation and kind of get out there in the community. I know that social networking and meeting people, especially through social media and LinkedIn, is a great way to kind of organize your applications and get mentors or get people who would give you advice. So that's a great way to do that. So I recommend it if you're writing the reflection anyway. So again, if you're interested in being in pre-health shadowing, we are 100% remote. It's fully volunteer. You get to pick your hours, your shadowing, or whatever you want to do. You could even work at like 2 a.m. if you wanted to. Everyone's up at random hours of the day, which I think is kind of fun. There's that. Again, if you can donate your time or your money, that's always lovely. Even if it's $1, you help our program stay free, and we are fully accessible to everyone when we have people who support our program. I know that we have a few partnerships in the midst. And so if you also have anyone that you recommend either speaking with us and they can donate their time to these sessions, or even if you have someone who might also want to donate to this, we are a nonprofit, so if you guys want to organize that, you can share this QR code with them or go to our website. So, what everyone's been waiting for, how to earn your digital certificate. I'm sure a few of you have already been with us in these shadowing sessions, so you kind of know where to go and what to do. But if you haven't, you're going to go back to the course page. It's where you got the link for this session. I don't know if you got it elsewhere. I would be surprised, but maybe one of your friends sent it to you. You just go to prehealthshadowing.com and you can just type in /Chambers, and that will come up with Dr. Chambers' course page. And the quiz is open now. It opens at the end of session, and we are past end of session. There'll be 10 questions. They're usually single choice. Some of them are multiple choice, and sometimes we have some true false in there. You need a 70% or higher, and you do get one retake. If there is any questions with that, or maybe your internet went out during your second retake and for some reason you just didn't get it, feel free to email us at info@prehealthshadowing.com and we'll happily accommodate any kind of challenges you had with that. And our quizzes are open indefinitely. So if you can't make it to the quiz right now, you can always take it tomorrow, next week, next year. We have other sessions up right now that have all the recordings. We do try to get our recordings up within 24 hours. So if you did miss any part of this session, you're more than welcome to come back in a day or two and watch the video or watch a section of the video. And then don't forget when you finish your quiz to click finish this course at the top. That's how you actually get your certificate. It'll go back to the course page and you can download it from there. It'll have your name and everything on it as well. So if you missed any part, again, it's going to be on our YouTube as well, but it will be on that course page in a couple days. So look out for that. Be sure to catch us. I know that we have a plethora of sessions. I think we have 4 sessions next week. So if you guys are interested in more sessions and you couldn't make it to a Friday session and you want to make it to a different session, go for it. The more the merrier. I love seeing new faces and I love seeing old faces. So thank you. See you guys next time, and thank you for joining. If you have any questions, you can stick around and ask our student team. I don't know if Dr. Chambers is going to stay for a couple minutes or if she's out of here. Have a great night, everyone.